Welcome back to the Advancing Healthcare Through Simulation podcast. Today, I'm very excited to be joined by Dr. Mohamed Benfatah. Mohamed is a healthcare simulation researcher and the founder of SIMAI Health, a Moroccan initiative dedicated to enhancing healthcare education through the integration of simulation and artificial intelligence. His work focuses on improving patient safety, strengthening interprofessional collaboration, and developing innovative, accessible training solutions for healthcare providers across diverse settings. So, Mohamed, welcome to the podcast. We're so excited to have you here today.
Thank you so much for having me on this podcast.
I'd like to start out touching on the fact that your work is really intersected between simulation, research, and artificial intelligence. What first drew you to simulation as a way to improve healthcare education and patient safety?
Okay, thank you for the question. And what drew me to simulation was the idea that we could create a completely safe space for learning, one where people can practice, make mistakes, and try again without putting real patient at risk. In clinical practice, and I'm nurse anesthetist, I work in hospital. Learning often happen during moment of high pressure or uncertainty. With simulation, we can slow things down. We can focus on specific skill, communication, challenge, or the decision-making process, and really impact what is happening. I was also fascinated by how simulation reveals in invisible parts of healthcare. BSS team dynamic, habits of communication, and event of the emotional side of clinical work. And and once you make this thing visible, you can actually change them. And simulation for me, it's a good tool, good way for good practice. And I'm very happy to be an educator, and also in researcher in the field.
So, let's say for listeners who might be new to simulation, in your opinion, what makes simulation such a powerful tool for transforming how healthcare professionals learn and work together?
Yes, for me, simulation is powerful for three main reasons. It turns knowledge into action, and also it's engage emotional memory, and also create a reflective space. For knowledge into action is simply knowing what to do. Learner actually do it. And also to engage emotional memory is people learn better when they feel the urgency, emergency, or the teamwork that real healthcare require. And through debriefing, you can examine why the decision was made, what cognitive shortcuts were used, and how communication shaped the outcome. Simulation is not just about practicing procedure, or it's about transforming the way team thinking and collaborate. Yes.
Yeah, and that little bit of stress that they might be under in that moment could replicate what they'll be experiencing out in their practice as well, right?
Yes.
So interprofessional collaboration comes up frequently in your work. And I'd like to hear about how you would say simulation helps teams better understand each other's roles, communication, and shared decision making.
Yes, yes, of course. Simulation places everyone, nurses, physician, pharmacists, all of the healthcare, in the same scenarios, facing the same challenge. And it's allow team to clarify rules and responsibilities, practice structured communication, develop a shared mental model, also understand how different disciplines make decision, and also build truths in realistic but safe environment. When team train together, for example, train together, they perform better together. For example, I'm doctor. I work with nurses. In simulation scenario, for example, team train together, they perform better together. And that directly translates to safer and more coordinated patient care. This is more important for the patient, is the coordinator patient care.
Yeah, in my experience working with learners, pre-licensure learners, really it seems like a lot of the time is the students learning about each other's roles, but I can see how continuing that into practice, people will just be able to refine the work that they do as teams and come together to create safer experiences for
Yes,
each other and patients.
of course. Yes, of course. Yes.
Okay, so artificial intelligence is becoming increasingly visible in healthcare, and I know you've been doing quite a bit of work in this area. So I'm wondering if you can share with us how you're using AI to enhance simulation-based training and clinical decision-making today.
Yes. Firstly, I'm a specialist, and I do my search in the AI and simulation. AI is a revolution, technological revolution, and we should learn AI and simulation. It's more important. We use AI in several ways: scenario generation, virtual patient, debriefing, analytic, example, decision support training. And I think I have a model, Moroccan model, in simulation, in the step in simulation. For example, in the pre-briefing, I use AI in pre-briefing, in briefing, in exercise of simulation, and also in the debriefing, and also for generate the scenarios. For example, AI helps us create highly realistic, adaptive clinical scenarios based on real world data. And this is very important. And also, virtual patient. We have many of studies with good results. For example, learner can interact with AI driven patient, how respond dynamically to the decision. And also debriefing analytic AI can highlight communication, or also timing and the decision points that human might miss. And finally, the support training. We simulate how clinician or physician can safely and effectively integrate AI enable human might miss. Also for the workflow. AI for me help personalize training, increase realism, and also simulation beyond the walls and physical center. For me, we should integrate in every center of simulation AI, because help educator also students, all of education, of all of students, medical workshop, medical uh, worker medical. Thank
So
you.
I've had a little bit of experience working with AI in a virtual capacity where one learner does a communication-based S-bar scenario, we'll say practicing their handoff, and they get that direct feedback exactly based on how they interacted, and it's been fantastic. But what I'm hearing you say is also including it in your physical simulation centers and working with students in groups. Is that correct?
For me, AI should never replace clinical judgments. Its rule is to enhance it, and I see AI as a second set of eyes and a cognitive safety net. It can reduce error, support reasoning, and also, but the clinician remain the decision maker. I think AI is assistance for human. It's not replace clinical judgment human. And for me, the results with AI is better than without AI. I think it's a good tool for using in the center of simulation with student, with educator, and all of team in center of simulation.
Yeah, I agree. I feel like there's a lot of questions about that and how AI might be taking over human judgment. And I can see, kind of envision, being in the control room, observing a simulation and having it help capture, because it sometimes can be quite overwhelming when there's a lot going on, multiple learners or participants. So I think that's a great example of how to support your simulation practices.
Yes, exactly.
So you founded SIMAI Health in Morocco to address specific educational needs. What gaps were you trying to fill, and what makes this work particularly meaningful in that context?
Yes, of course. I'm a founder of SIMAI Health Morocco, Simulation AI Morocco. I funded with love because I love simulation. Yes, and the gap was access to high quality simulation and modern training tools in the region, in Morocco and the region, Arabic and Francophone, French or Spain, and also in Africa. And many healthcare professionals wanted to learn through simulation, but traditional simulation center are expensive, and you know it. And also we have with material expensive, and also we create semi health to democratize simulation, to give more facilities for educator in the region, Africa, and also in Europe. And also you can find solution with hybrid and mobile solution, AI supported training programs tailored to local health priorities. And for me it's mindful because it's align innovation with equity. Every healthcare professional should have the opportunity to train in conditions that prepare them for real world challenge. And I'm very happy to collaborate with CAMS and also with different center of simulation in the world for more projects and more solution and more facilities for education in simulation.
Yes, we are very happy to work with you as well. And I think, collaborating so broadly brings in those diverse perspectives and really get a better sense of that interprofessional team dynamic. So that's fantastic to hear you're able to do that for your region and more broadly globally. As you mentioned, accessibility is a challenge worldwide for simulation. So, how does SimAI Health approach creating innovative, scalable training solutions in a resource diverse setting?
Of course, in SIMAI Health, we have a strategy for working, and we focus in three strategies. First is modularity. For example, we are small, flexible, and simulation tool and a set of large fixed installation and the digital and AI based solution, and also capacity of building. We have three strategies. For example, we train local educator, so the programs grow within the system. And also, it's not about replicating Western models. It's about designing solution what fits the context, the budget, the budget, and the local healthcare realities. And I think we are in the way, and I believe this small semi-health in Morocco, and also we have many of strategic, many of solution to collaborate and to give it for educator in Morocco and also in Africa, and when we collaborate.
Sounds like a real focus on what's needed in those specific areas and doing your typical needs analysis there, which is great to hear that you're able to match it to the needs of the organization and the programs. So looking ahead, I'd like to hear what excites you most about the future of simulation and emerging technologies. What impact do you hope that they will have on healthcare education and patient safety?
Yes, what excites me most in the convergence of technologies, AI, extended reality, wearable sensor working together to create deeply immersive or personalized learning. I believe we're moving to get toward simulation that is continuous learning every day, not just is a session. It's everyday simulation, every second, every hour, and also data informed. Example, real performance guidance training, and also, and very important, it's accessible globally, and also in clinical practice, not separate from it. The ultimate impact, I hope for, is simple but is profound. Better prepare team, fewer errors, and safer care for every patient everywhere.
So maybe one more question, because I think there are lots of simulationists out there that are, interested in AI but haven't yet broken into that area. Do you have any recommendations for folks on how to get started in integrating AI into their simulation programs?
Yes, I think every educator should find a way for use the AI in the program simulation. Firstly, we start with easy tools. For example, in my study in 2022, I use ChatGPT as a patient, virtual patient, and this study, I start with this study, and give me a good result, because this generation educators, students use every day every second the technology. And this is good for educator for using this small tools and a big impact. For example, we use ChatGPT every day, SIMAI or anything, and these tools we can use it in the education, and we can also in the future develop the tools for us, AI for us, and we can create. The educator should create the tools, create the strategic pedagogic strategic for the students. And I think in the future all will change with AI, and also simulation will change. New generation simulation. It's not just material. No, we should use and take technologies, and also take a good pedagogic and new pedagogic, digital pedagogic for our programs and for our students, and also for our center of simulation.
Well, thank you so much, Mohamed. We really appreciate you coming and joining me on the podcast today, and for really being a leader in AI and simulation. We're really excited to see what comes next and what you put out there to share with the world.
Thank you very much for your invitation, and I'm very happy to be here with you in this podcast. And I wish work with you in the future, and also finding the new solution for the educator simulation, center simulation, and all of the worker simulation. Thank you.
Yeah. Thanks again for joining us, and thanks to everyone for listening to Advancing Healthcare Through Simulation.
Thank you very much, and thank you also for all of the listener in this podcast. And thank you for you, Lisa, for the big invitation, and I'm very honored to be here.
This series is proudly produced by the team at Road 55. Road 55 creates content that connects. For more information, visit our website at road55.ca.